Hello everyone, welcome back to my YouTube channel. I'm Dr. Smriti Shrestha. I'm a dermatologist and hair transplant surgeon. Today we have a very special guest with us, a very beautiful, very talented upcoming actress, Miss Sol Gurung.
Hi everyone, my name is Sol. I am nurse by profession, currently doing content creation and an upcoming actress. I'm really excited to be here at Anova Skin and Hair Clinic with Dr. Smriti today.
Thank you for a sweet introduction. I really wish you well for your upcoming projects and we wish to see you more in big screen.
Thank you.
Alright, now moving forward, we know each other for quite a while now,
Yes.
and we have done few procedures at our clinic, and you've also ventured internationally into multiple clinics to do so many skin treatments, and I can very easily say that you are a skin enthusiast, right?
Yes. Yeah.
Yes. And I'm really keen to know what procedures you did when you were in Bangkok, what procedures you did when you were in Korea, and what changes it brought into your skin, and how did you know about it? Tell us everything.
So, as you said, I am a skincare enthusiast, I would say. When I went to Bangkok, I think the skincare procedure felt more like luxurious.
Wow.
It was more, like
Enticing.
yeah, like result driven.
Okay, wow.
They would want to, like, they would keep on updating me and ask me, like, oh, how is it going and stuff. Whereas in Korea, my skincare treatments felt more like a ritual, you know?
Oh, wow.
It was like going to the dentist. Like people would go, like my friends, they would be like, oh, this week I have to go to to see my dermatologist. And they would go like every week. And it was more fast paced, I would say.
Wow.
Sometimes it could feel a bit like a factory.
There are factory outlets.
Yeah,
yes,
you know.
there are different kinds of clinic, right?
Whereas in Bangkok it was more like, as I said, like luxurious. Like
Yes.
it was more like a lifestyle thing in Korea. Whereas in Bangkok was like a little treat for yourself every now and then.
Oh, wow.
And I think Nepalma pani त्यो culture चाहिँ नि आइरहेछ.
It's coming. It's
Yeah.
coming.
And I'm so happy to see that.
Yes.
Because पहिला त्यस्तो थिएन होला, I
Right.
think, you know.
Yes.
Yeah.
Yes. To the inverse, I just want to say that there are factory outlets in Korea. There are private clinics in Korea. Factory outlet ko matlab chahi lots of people go to the same place. You do not get too much of privacy. You do not get premium treatments, and the prices are much lower compared to the private clinic like ours, right? So the factory clinic culture is really huge in Korea. There are so many places where we can really just hop in. We don't have to wait too long for appointments, and the procedure is done quickly, and then you can go back home. And that culture is really growing all over the world. I asked Miss Sol about this whole thing because I'm also somebody very, very interested in learning Korean culture, Korean skincare trend, and how people very young are actually trying to stay upbeat at the anti-aging game. There's actually the newer, there's a new saying that it's more about preventative aging than about anti-aging. So we are trying to look for prevention. In recent times, the youngsters, the Gen Z and the youngsters are looking more for preventative medicine or preventative treatments than actually going for anti-aging when the wrinkles have actually set in.
Yeah.
So would you mind telling us what treatments that you did, tapaile ke चाहिँ गर्नुभयो, and what did they say that they targeted a different, and what kind of results that you saw? Maybe we can start with Korea. What happened in Korea?
I think मैले के चाहिँ नै गरिनँ भन्नुपर्छ. Because my main problem was actually acne, right? So I struggle with hormonal acne a lot,
I'm so
even
sorry.
at this age. And then we did like blood tests and everything, and they recommended me like this whole package of treatments. They included like Thermage, what was it?
Potenza,
Potenza, Fractal Duo, Pico Laser.
Right.
So
you did a cocktail of everything.
Yeah, everything. And it was like in a one day.
Wow.
So I asked the doctor, I was like, is this safe to do like 8, 9 treatments in a day? And they were like, people do like 10, 11. This is nothing, you know. And after that, I did see like my skin got a bit more smoother, I think. Because this was my first time doing 80-day treatment in one day. I think my skin really needed that detox kit.
Right.
It was like a new layer of skin that came out. And
Rejuvenated skin.
yeah,
Right.
I saw a very big difference.
Yes.
What I realized is that एउटा मात्र treatment गरेर चाहिँ नि नहुँदो रहेछ. You need a mixture of it. Ani, you have to be very consistent.
Right. Right.
So I did see a result, but I think I would have seen better result if I was there for like a longer time and I kept on doing it like every month or so.
Yes. we were there together in our Vivace launch this year, I think last year in March. So if you remember, I had also talked about this sequence of treatment that happens in Korea, and I had mentioned that Vivace is one of the treatments that they do in the whole series of the treatments. So the devices that we talked about recently, so many people may not hear about them, may not know about them, but these devices are basically the names. These are brand names, while the actual treatments are like HIFU, ultrasonic treatments, microneedling RF, laser for pigmentation. So all of them are done in one go, one after the other in a series, when they start with the less invasive treatments first and then they go towards the more invasive ones later on. So this is meant to treat all layers of the skin. For example, if you do a skin booster, the Korean booster that we're talking about recently, so the Korean booster is mainly aimed at epidermis and dermis. So many times when I talk about Korean boosters, people don't have a sense of expectation, what to expect from the treatment. They probably do not know about the downtime, the recovery time. So Nepal, as you said, people are growing into the skincare trend, but they still somehow do not understand the concept of downtime, recovery time. So, हजुरलाई चाहिँ त्यो कोरियामा जब जानुभयो, how was the recovery time? How hard it was? How easy it was? Was it as expected?
I think it took some time, like 2-3 weeks जति चाहिँ नै लाग्यो.
लाग्यो?
लाग्यो.
2-3 weeks?
Yeah.
Wow.
I think it depends on person as well, like individual. For me, I think it normally takes longer to recover.
Okay.
And since I got such extensive procedures like at one go, I think that's why it took long. Because I actually got microneedling on my neck as well. That was like really short downtime.
Did you get Botox done? No.
Skin Botox, yeah.
They did, right?
But then they said my wrinkles were so deep
Deep?
No, really deep.
Okay.
It was so deep that I need to get like 4 or 5 sessions. I only got 1.
Oh, wow.
So I didn't see like instant result, but that was due to my own.
Okay. The skin Botox that you're talking about, in medical term, we call it micro Botox or baby Botox. So the skin Botox generally on the neck would not resolve the deeper lines that you're mentioning. Even in 5 sessions, I don't think that would resolve it completely. A better treatment for the deeper, already existing lines on the neck, which has been there not because of aging, but because of your genetics. So those lines are better catered. These kind of lines are better treated by skin boosters. If you would look at it, the skin boosters, that is hyaluronic acid, not the Korean boosters. Because the name skin booster is so vague. It's such a vague term. So I think for your necklines, skin boosters that contain hyaluronic acid, along with some amount of, very little amount of Botox would do the job, I think.
Yeah, they did say like filler ones and it would be better, but then I didn't have time. Like it was such a rush decision. So I was like, okay, I'll just try it once.
But you had done so many things. Of course, going on top of it with a filler would have been difficult, I know.
Yeah.
So, Moche, I'm quite well acquainted with these kind of treatments in Korea. It was pretty, for me, ekdam interesting थियो, and that's why since the last 1.5 years, मैले यो build गर्दै ल्याएको चाहिँ, I really wanted to have the whole setup in Nepal regarding this whole thing, because if you have ever watched Kim Kardashian's video, she has also gone to Korea to get the MNRF done. She's done the set of procedures that you've done, and the main aim for these treatments for the short term is to get that glow. But the Korean glass skin that most people would say is virtually impossible is now becoming some amount of reality. It's not a full reality ever. That's not going to be possible. But then some amount of glass skin can definitely be achieved with a series of treatment that Miss Sol has done in Korea. And I'm really glad to be hearing this, firsthand from you, because like this is something I was also looking forward to get it done. But then my time was really short. I stayed there for only a few days, so I didn't get it done this time. So hopefully next time I'd like to get it done too. So coming to Bangkok, so was Bangkok your first experience or Korea your first experience?
Bangkok was actually my first experience. So, because the previous time I went to Korea, I was like so focused on traveling.
Okay.
So when I went to Bangkok, I could see like how much they consumed skincare, aesthetics as well.
How serious they are.
Yeah, they're so serious. So I was like, oh, let me try it too. So Bangkok was actually my first experience.
So regarding this, I don't know whether everybody know, Seoul is actually based in UK generally. So I have a question, like comparing youth in Nepal versus youth in UK, how much is the social acceptance among youth and among the older generation to the aesthetic treatment? How open are they in UK versus in Nepal?
I think UK ma more open to, because like it's so normal to people.
They don't judge you.
Yeah, like the stigma is not there.
Yes.
You know.
Right.
Like as soon as Nepalमा चाहिँ नि मैले के notice गरेँ भन्दा as soon as they hear injectables, they just give you the side eye, you know, like, oh, okay, she's pretty because she's doing all this. But what people need to realize is that in order to maintain this glow, this prettiness, everything, you need to keep doing stuff.
Yes, of course.
Skincare cream लगाएर के पनि हुँदैन,
Obviously,
you know.
right.
You need to, as I said, like it's basically like going to the dentist. Just because you brush your teeth doesn't mean like your teeth will look really good.
They will not rot or teeth. Exactly.
So, and then it's personal choice too. Just because someone does it doesn't mean that it's not a good thing. Whatever.
Exactly.
If you're not interested, it's fine. But just the judgment is there. But I think slowly it's getting normalized as well. And the more we talk about it, I think it's better. And we're not like trying to enforce people like, oh, garni garcha bhaneर.
Exactly. It's your personal choice.
Yeah.
Right.
But what we need to say is that, you know, you have to maintain everything.
Yes.
No,
if you are, I think it's entirely personal. When patients come for cosmetic procedures, I would never ever point out a certain issue on her face.
Yeah.
I never do that. I've never done it because if she doesn't like a certain thing, he or she, they will tell them themselves. They would have told me myself. They were मैले चाहिँ यो गर्नुस् भनेर from my end चाहिँ कहिले पनि भन्दैन किनभने यो personal choice हो. Everybody has some insecurities while somebody is comfortable with what they want. So, but just because somebody else did it doesn't mean the other people have right to judge them. त्यो चाहिँ मलाई ठीक लाग्दैन के.
Yeah.
Interesting, funny incidences कस्तो पनि हुन्छ भने so many times. I think it's very common in Nepal. Lots of women would identify with this होला कि many of the women who are working women, quite earning well ले पनि बोटक्सहरु गरेको they don't tell their husbands के कति जनाले के अरूलाई त ल भनेन हैन. So आफ्नो घरमा कति जनाले husbands लाई भन्नुभएको हुँदैन. आफ्नो peers हुन नि among their friends, ladies in my age, 40s को ladies हरु who have been treating for 4-5 years, they'd come and joke कि म यतिकै राम्रो देखेको भन्छु मैले साथीहरुलाई भनेर त्यो चाहिँ अब शेयर गर्नुपर्छ जस्तो लाग्छ के मलाई चाहिँ because it's your personal choice. मलाई लुगा लाउन मन लाग्छ, गहना लाउन मन लाग्छ भने त्यसलाई सुट हुने फेस बनाउनु पनि त मन लाग्छ नि. Just because I'm 40 plus, मेरो इच्छाहरु त एकैचोटी त जाँदैन नि त. So I really think from this short video, we'd like to share a message. I think it's fine. If you want to get it done, it's fine. If you don't want to get it done, it's fine. So it's I think more polite not to judge them on their face. त्यो चाहिँ गाह्रो छ, especially social media मा कसैले मैले यो गरेँ भन्यो भने the kind of backlash that you see, it's crazy के. त्यो चाहिँ I hope it gets better in Nepal slowly.
I think it is slowly. Like people are accepting it slowly. तर it will take a time, like long time. I think it will only change if people are more open about it and we educate people, like the scientific reason behind why we get Botox.
Right.
Ramri matra dekhinalai no.
Exactly.
Like, when I got my Botox on my masseter, it's because of my DMJ.
Right.
I have like grinding issues when I sleep. So it's not just for cosmetic reasons. It could be for scientific reasons that you're, not happy about.
Yes. So if you don't like something about your face, it's up to you to decide whether you want to do something about it or not. So I think obviously that awareness is slowly coming. As you said that you did so many procedures at one go, that's actually very common in Korea, and for me that's not new. So what we plan in Nepal for a similar range of treatment is how we do it is first you cleanse, we remove the dead cells or exfoliate. That is followed by a non-invasive HIFU or ultrasound session that leads to deeper tightening. It goes up to the smash layer, so it tightens the skin. The heat is more deeper. And then it is followed by a microneedling RF, which is more of an invasive procedure, but it's more superficial. Nowadays, we don't go for very deep microneedling RF. We'd like to stay superficial because of the potential risk of fat loss if you're doing it too much or if you're overdoing it. So that caution is being kept. Followed by that, we do skin boosters. You can go for injectable skin boosters. You can go for Korean skin boosters. We do PDRN. And then you can also top it up with some amount of meso-botox or micro-botox. That'll give that perfect shine. And these treatments usually not last for more than 3 months. When you do it once, the results that you see would last for 3 months, except for some of the treatments like HIFU, which would last for 1.5 years. So When you go for these sessions, we do not go in to expect a big change with one session, but then if you don't have time, at least if you do it once a year, some changes in the skin will be there and some amount of rejuvenation will be there. And interestingly, we know that a microneedling can increase your collagen by up to 400%. So MNRF can also do the same. So when you do a MNRF along with the HIFU, especially if you're staying abroad, this is for people who are especially staying abroad and they don't have time or money or like resources to continue doing it every 2 to 3 months, then they can do it all at one go and then do it again next year. So that would also work for them. As you just said, now we'll dive into a more scientific topics and about the scientific concrete information that we are trying to give via this video. So I want to ask you skincare routine. What's your daily routine?
I'm trying to keep it quite simple these days. I am more focused on मेरो skin barrier, अनि cleansing really well. So it starts off with a milk cleanser because I've realized मेरो oil cleanser is not really suited for my skin. मेरो acne को लागि चाहिँ राम्रो नरहेछ. So I use a milk cleanser and then I'll start off washing my face with like a foam wash, really gentle one. And I have been using cotton like toner pads. And then I'll go on with my moisturizer. If I'm feeling really fancy, then I'll use some like serums.
Okay.
But I try not to.
Really?
Yeah, I try not to. Like, I realize like the more easy and simple I keep it, the better my skin gets on it again.
Okay.
And then obviously the non-negotiable, I use my sunscreen.
Okay, that's in the morning.
That's in the morning.
Okay, so you're not using at the moment, not any antioxidant in the morning?
No.
Okay,
that's... At night,
all right.
I use an ampule, like tone brightening ampule.
Okay.
But just my
not so much.
Yeah.
Okay. I would recommend at least to use one antioxidant in the morning because the sun rays are getting worse by the day. Sun rays, UV rays, pollution, so many things are attacking us all the time. So normally there's a saying that our skin gets irritated in the day, it gets injured in the day, there are micro trauma that happens in the skin and it gets repaired at night. So what you're using at night for the repair basis, I think that's great. In the morning, if we can use one antioxidant which does not work for the full day but still for a few hours, it will quench or neutralize the oxidative damage caused by these harmful chemicals and the rays that are happening all around us, especially pollution. So I think if you're acne prone, maybe a very light, something very light on the skin that doesn't feel very heavy or that doesn't clog your pores, a nice serum that has probably niacinamide in it or some antioxidant in it would be great, but not vitamin C, because in acne prone people, vitamin C may not be doing that great.
Yeah, it didn't work with me.
Yes, it usually doesn't.
It doesn't work with me.
Yes, it doesn't work in acne prone people. Now we know.
Yeah. So I've seen a lot of skin boosters, I know, social media ma pani, every time I scroll through, it's always like PDRN, salmon DNA, I got injected salmon DNA on my skin, so why is PDRN and salmon DNA like so hyped up at the moment?
Recently we have also introduced PDRN, polynucleotide and PDRN in our practice, which are slightly different thing. They're all derived from salmon DNA and they're popular because of their miraculous regenerative property. It's actually written in research papers ki quote नै गरेको छ कि having near miraculous regenerative properties भनेर. So these are known to heal your skin in every possible way. These are basically healers. That's why so many of the brands also advertise saying PDRN, this healer. So because they heal the skin from within, from all kind of issues. For example, they would improve your fibroblast synthesis, they improve the collagen synthesis, they improve the DNA damage. The basic pathomechanism of aging is DNA damage. They're basically the most powerful healers that we have in today's times. They heal the skin as well as hair in many ways. They improve the fibroblast synthesis, they increase collagen synthesis, and they do DNA repair. And if we look at the pathomechanism of aging, DNA damage, telomere shortening are the reasons for aging, and they improve the DNA damage, leading to improved aging function, anti-aging benefits, fine line improvement, and they also work miraculously on melasma. As we know, melasma is a chronic and recurring entity. It comes back no matter what you do, and you stay in a routine for a year and then you go out in the sun for 2 days, it comes back like crazy. So the basic pathomechanism of melasma is also now known to be chronic recurrent irritation, inflammation and damage in the skin, which is very well healed and addressed by a PDRN. So polynucleotide also helps in people with melasma, and it's also preventative.
So who can do it? Like, is there age limitations?
Usually all aesthetic procedures are indicated above the age of 18. Normally that's what the international guideline is. So anybody who's older than 18 who has certain issues of pores, your skin texture, fine lines, pigmentation, melasma, freckles, sensitive skin. Nowadays sensitivity has become a big issue. Every second person heats up very easily. They quickly become red in exposure to sunlight, in exposure to heat and anything. So that sensitivity is a predecessor, it is a precursor for melasma. Who has sensitive skin, those who has freckles, those who have any kind of hyperpigmentation will eventually develop melasma. So these people, if they start polynucleotide or healing treatments early on, they can prevent and maybe heal the melasma as well.
So what are the risks and safety? Like you're injecting salmon DNA, is it harmful?
Right. So yes, of course, Sundata Dor Lagda Laksa. So I had asked the same question to one of the doctors in one of the international conferences a year and a half ago. So wahako answer is saying, don't you eat salmon? That was the answer. But coming to the scientific terms of salmon DNA, they're actually purified DNA fragments which does not contain any proteins. If it's a good brand, ideally it is 90 to 95% purified DNA, which shouldn't ideally contain protein contamination, because if they have protein contamination, the chances of allergies, hyperpigmentation, bumps, foreign body reactions to the PDRN injections are there. So I'd like to say from this video that it's not just about doing it, but it's also about knowing the quality of your product. Because in countries like Nepal and India, lots of low quality products are floating in the market very easily, and price bracket is something that should not judge your choices. Your choices, I think your choices should not be made on price bracket, but be made on the quality of the product. It's better to have a study about the product that you're doing and then go ahead with it. That would ensure some safety.
It's really important to get educated, I know.
Yes.
Because like as soon as people hear about salmon DNA, they're probably thinking like, they don't think about like refined and stuff. They'll just be like, oh, salmon butter nikalera directly inject whatever.
I think same with the Botox, right? Even so many people have not even heard about allergen Nepal mata. यो भन्नु त हुँदैन. It's, I think, sounds more sponsored, but this is not a sponsored session. So we just talked about a brand which is internationally approved. This is the world's first and the oldest botulinum toxin. But then people don't know about the product. That's why they do not understand the difference between the price bracket. Same goes with PRP, same goes with GFC, the same goes with fillers. Even fillers, the world renowned fillers versus some local fillers which can give you any kind of sensitivity, as well as the results may not last as much as they would, especially with PDRN and especially with the exosomes, which is very popular nowadays. With PDRN and exosomes, the product quality really matters in giving the results. You know, there's so many people who did 3 sessions, 4 sessions with no change. That happens because the product is inferior. It's not a good quality product. So that awareness is also very important.
So if once you get like salmon DNA injected or like PDRN sessions and everything, like what skin conditions are you seeing to like expecting to improve?
The most common reason for people doing salmon DNA all over the world right now would be texture and pores, but it also helps with fine lines, and it really greatly helps with melasma. Also, it's not, although this is not direct indication for melasma, you can't go and claim that doing PDRN alone will improve your melasma forever and you don't get it again. That's not how it works. But so many doctors all over the world in conferences have admitted, and so many papers now are being published, that it works for melasma in the long run, not just in the short while, but in the long run. It works in preventing melasma as well as treating the pigmentation.
So consistent hunu paryo.
Yes, consistency. And regarding the consistency, normally you have to do it at least 3 sessions. It's not something that you can see results with 1 session alone. You need to have time for 3 sessions, at least 21 days apart. And if you're older, the session could be up to 4 sessions. And if you have very bad melasma, your skin is triggered, irritable, and it's sensitive, then you may have to go slower. So there's a difference between the number of sessions that people do depending on their skin type and the skin need at that moment.
And I think I saw like PDRN pani numbers mount, like how many units is in there in a skin?
Not unit, it comes in mg per ml.
Mg,
yes. So normally if you're doing under eyes, you're doing 15 mg per ml and you can do as less as 0.5 ml. But if you're doing full face, it comes in 40 mg per ml, which is a high concentration, and that requires more amount, maybe at least 2 ml for the full face. So that's how it works. And regarding that mg per ml also, PDRN is not polynucleotide. These are different things. PDRN is a smaller molecule, so this is more of regenerative properties. It doesn't volumize at all. While polynucleotide is a larger chain. It is a larger molecule and it volumizes as well. So since it's a bigger product, it leads to stimulation and volumization. That's why for under eyes, it's better to stick to polynucleotide if you have dark circles and tear trough. But if you're only looking for collagen boosting, you can go with PDRN. So these are slightly different in terms of scientific product.
So what are these viral skin boosters that you've been promoting? I know मैले पनि देखिरहेको थिएँ. What's like the pain, downtime, swelling?
Yes. Yes, यो चाहिँ एकदम important question हजुरको. किन भन्दाखेरि people hear Korean and then they jump into the treatment without knowing the downtime. हैन? So downtime is, what is downtime? Downtime भनेको चाहिँ recovery time हो कि कुनै एउटा प्रोसिजर गरेपछि हजुरलाई कस्तो देखिन्छ, कतिको swelling हुन्छ, marks बस्छ कि बस्दैन, घाममा जानु कहिले मिल्छ, when you can resume your daily activities. हो यो कुरा चाहिँ अहिलेको कन्टेक्स्टमा चाहिँ awareness हुनु जरुरी छ. These Korean boosters that we are talking about have a lot of things. They have PDRN, they have exosomes, they have even NAD. So this does have a downtime. यसको चाहिँ blebs form हुन्छ. Korean viral skin boosters भनेर गुगलमा हेर्नुभयो भने जस्तो किसिमको blebs form हुन्छ, हाम्रोमा पनि same those kind of blebs form, and it is not 1 or 2 points. So multiple points मा face मा inject गर्ने treatment हो. So these blebs in some points may leave a bruise. Even if they don't leave a bruise, कतै कतै चाहिँ हजुरलाई swelling जस्तो for few days, for up to 4-5 days नै बस्न सक्छ. So Korean boosters, if you're looking for that cocktail booster, the recovery time, I would say, would be around 4 to 5 days at least. Regarding these cocktail treatments, as we remember, around 18 months to 2 years ago, you also did one HIFU session with us.
Yeah.
So how was your experience? Would you like to share it with us?
Yeah, it was actually my first time. It was actually my second time doing it. I did one in Bangkok.
Right.
It was very similar to what I got in Bangkok. You know, the machine that you used, the technique that you used and everything, it was very similar. It did work for me, but then I was already aware that it was not going to last like forever.
Right.
So after like 6 months, I knew like I had to like top it up again.
Yes.
The pain, I wouldn't say it's painless, but it's manageable.
Right.
Like depending on how high your pain tolerance is.
Discomfort?
Yeah, discomfort.
Tightness, some tightness.
Yeah, especially after you do it, you can feel the tightness. But I guess that's telling you that it's actually working.
Right.
Because the main goal is to tighten your skin. So yeah, I actually had a great experience.
Thank you. Thank you so much.
I would want to get it again.
Sure, of course, please do. Oh, but it's time also. It's time already.
Yeah, and I know like हजुरको clinic you guys do loads of hair transplants. I always see it. I know. They're like, how often like women get it? Because I always see like men most of the time.
Yes.
Do women get it as well?
Yes, we do hair transplants in women, but it's definitely not as common as in men. Why? Is because women do it for two different purposes. One, they do for forehead reduction. So someone like me who has quite a large forehead. So sometimes someone would want to reduce that forehead. That's called forehead reduction. That's for solely aesthetic purpose. That doesn't need any other treatment or anything to be done later on because the hair will come and that's the end of it. While now so many women are suffering from baldness. Recent statistics came. It was horrifying. 2.3 billion people all over the world suffer from hair loss. Imagine the kind of epidemic that it has become. So now more and more women are also coming for hair transplant because the kind of hair thinning that they experience, that is not only manageable by medical treatments anymore because the hair loss has become faster. So now if you look at it, the progression of baldness in both men and women is much faster in the last 5 years, especially after COVID, than before. So that's why men and women are both balding at a very rapid rate. So when you use certain topicals like minoxidil alone, many of the people who have already gotten bald, they will not reverse. So what our community generally expects is using minoxidil will give us head full of hairs, which is definitely not true because minoxidil only holds the hair. It doesn't block the hormone that causes baldness. It doesn't revert the baldness. It doesn't regrow the hair. So people who have already balded much where the scalp skin show is visible, whether it's men or women, that's the time that we fill in the blanks. So I always tell my patients that we fill in the blanks with hair transplant. We stop new blanks from coming with the medical management. So both have to go hand in hand. Yes, women do it quite often. We've done it in a lot of patients in women, but the ratio of men is to women is much higher in men compared to women.
Maybe women are not aware of it.
It's not about awareness. It's more of a scientific basis behind it. For example, in men, there's a very strong donor zone. The donor zone that doesn't get affected by hormones that cause baldness. This is called donor dominance theory. So in the past, there used to be a very strong donor dominance theory in men, because of which when you transplanted the hair from the back to the front, they would never go. It would be virtually permanent. But now that's changing in men as well. Unfortunately, men's donor is also not as permanent as before. And in women, we didn't do it before because they had global baldness. Women did not have that phenomenon of donor dominance. That's why if you put a hair from the donor to the front in a woman, we expected that they would continue minoxidil. If they didn't, even that hair would fall off, the transplanted hairs. So it's basically about the longevity of transplant that hindered women from undergoing hair transplant in the past. But now the situation is the same for both men and women. Even if you undergo hair transplant, men and women both need to continue their minoxidil. And that's the bitter truth that we have come up to now. Thank you so much. It was such a great pleasure having you. I think we had a pretty nice and comfortable conversation with you today. Thank you so much. And would you like to share something with our audience at last?
No, thank you for inviting me. I feel like I learned so many things, which I always do. I feel like every time I meet you and we have a conversation about, and mostly our conversation is about skincare, treatments and everything. I really enjoy it because I get loads of information, you know. And I also want to say that so हाम्रो मुभीको सुट चाहिँ नि अब लगभग र्याप हुन आँटिसकेको छ डेट चाहिँ नि अहिले फिक्स भएको छैन बट आइ एम होपिङ जुलाई अगस्टतिर आउन सक्छ होला मुभीको नाम छ पेन्सन पट्टा आशा छ हजुरहरूलाई एकदमै मन पर्छ भनेर बिकज दिस विल बी मेरो फर्स्ट प्रस्तुति हजुरहरूको माझमा Thank you so much for listening to us and tuning with us. I hope you guys have learned a lot about skincare and its treatments with Dr. Smriti.
Thank you. Thank you for staying with us for this long. I hope you guys learned a lot and it was informative for you. If you have any more questions or comment, please don't forget to comment here and do subscribe to my channel. Thank you.
Thank you. Bye-bye.